morning, or good afternoon or evening, wherever you are. My name is Kenneth Amechi. I'm a professor of business and sustainable development at the University of Edinburgh in the UK. I also hold a chair in sustainable finance and governance at the European University Institute, Florence. I'm also a part-time chief economic advisor to the Imo State government. I'm happy to welcome you to today's webinar series, and it's a very important day for Nigeria. So I wish everyone a happy 62nd independence. And today we are looking at the business of health. Health is something everyone should take serious, both at an individual level as well as the country level. So we also think about the 62nd anniversary or independence of Nigeria as one to talk about the health of the country and the health of the population. So today, permit me to welcome you to a very interesting panelist. We have the Honorable Commissioner for Health in Imo State. But I will co-moderate this with Dr. Jude Zako, and I invite him now to say a word or two to the audience.
Good morning and good afternoon, wherever you are. I welcome you all to today's webinar. Viewers all over the world who may be watching, I wish you all happy 62nd Nigerian independence anniversary. I hope you have a great time listening to us today. Thank you.
Thank you. Then I invite the Honorable Commissioner for Health to give us an opening remark.
Hi, good afternoon, everybody. Happy 62nd independence to all of us. I'm happy to welcome you to this webinar. And this is a webinar that has to do with all of us. Health is wealth, and a healthy nation is a wealthy nation. So we're going to actually see all the opportunities in the health sectors today. I love the fact that we have very, very wonderful panelists on board, and I will look forward to very interactive session with everybody. Thank you very much and welcome to this webinar. Thank you.
Thank you, Dr. Sussex Prosper, the Honorable Commissioner for Health at Imo State. So let me go to the panelists straight away and ask them to reflect on the different actors involved in the business of health in Imo State, or I mean, even outside Imo State. You know, what would be the, if you look at the landscape or the different actors that might be involved in this sector, who are they and what do they look like? So let me go straight to Dr. Uchenna Ewelike. He will introduce himself and in terms of what he does, and then reflect on this question.
Thank you very much, Professor, and happy 62nd anniversary to Ndimo because it has its own peculiarity. The actors in the health sector include the state and non-state actors, but the focus now all over the world is on universal health coverage. So being a universal health coverage agenda, most of the focus now is on public spending. So the major actor here is the government, and all other actors are the people. And for us, critically in the health sector, we have other actors that are involved in service delivery, which include the doctors, the nurses, the laboratory scientists, the technicians, dietitians, and all that.
So let me go over to Dr. Dozie Ihiono to reflect on the same question. Introduce yourself, what you do, and also how you see yourself as a player in the health business.
Good morning, Imo Lights. Dr. Dozie here, MD, Dawson Medical Diagnostics, Owerri, Imo State. When we talk about actors in the health sector, we're talking about individuals or groups with interest in healthcare system. And this includes, like the previous panelist said, medical lab scientists, doctors, nurses, radiographers, optometrists, dietitians, and every other person who actually have a part to play, including entrepreneurs who actually have interest in healthcare, and then government who has a major role to play in the health sector business, and then with their regulations and everything. So for us, as a medical lab scientist, we have huge role to play, like every other person in the health sector. And we have so many opportunities, and we have challenges as well. And that is the reason why we're here to discuss and elaborate and then enlighten Imolites, and as well as entrepreneurs and the people who haven't really seen that there are prospects in the state, so that they will be aware and then know what we do and the prospects in healthcare industry in Imo State, so that they can come down and then do their business, because business is all about give and take. While you give, they take, and they take, you give, and everybody is happy, and healthcare system in Imo State is moving well, and there is ease in the healthcare system in Imo State. Thank you so much.
Thank you, Dr. Dozie Ihonu. Let me move to Dr. Nkechi. You are a medical dietitian, if I get that right. Maybe you want to introduce yourself and what you do, and probably also reflect on the business opportunities in that area, because ordinarily people may not see that as part of the business opportunities in the business of health.
Yeah, good morning, everybody. It's good to be here. Good morning, Imolites. Happy Independence. My name is Mrs. Nkechi Anyang. I am a medical dietitian and nutritionist. I've been in practice for over 30 years. I've worked in various hospitals. I live in Lagos, and I've worked in various hospitals, local hospital. Presently, I'm in multi-hospital, private organizations, corporate bodies, in homes. We're all over the places. Once you're thinking about healthy living, you think about good food. And when you're thinking about good food, you think about nutrition and dietetics. Very, very important aspect in the medical line. There is no way a doctor will come in, there is no way a pharmacist will come in that we will not be there, because we study food and its relationship to preventive and curative medicine. Very, very important. You can never go wrong with food, never go wrong, and food-related ventures. In Imo State, there are so many opportunities, so many of them, not just in Imo State, globally. Food is where it is. From the kitchen, from the farms rather, to the kitchen, all the way down. The value chain is endless. So we'll get to talk about most of them as the program progresses. Thank you.
Okay, thank you. Maybe you can stay on that, since we've already started talking about opportunities. So in your space, do you want to tell us what your typical day looks like? Or, assuming, people in your sort of business, what sort of activities do you have, or what sort of offerings do you provide, and who are your clients,
Yeah, when we talk about, like I said earlier, as a nutritionist and a dietitian, we're into preventive nutrition and curative nutrition, what we call clinical nutrition. We deal with people that are well and people that are sick of any kind of ailment. We use food to treat them, just like we use drugs to treat most of these illnesses. We also use food to treat most of them too, in addition to the drugs. So there are so many opportunities in that aspect, in that relation. You can come in as a nutritionist in the hospital, as a dietitian in the hospital. As a nutritionist, you can be a nutritional coach, a health educator, We need them all over the places, in the clinics, in the rural areas, in the grassroots areas. We need nutritional coaches everywhere, the health educators everywhere. And we can start from there. We also need fitness instructors in the gyms, in so many places. We need them. And the opportunities are everywhere in Imo State. And then in the food industries, there are so many food industries in Imo State, from your fast food centers to the regular regular joints that you have in Imo State, to the bakeries, to the food farms. There are so many of them. So we find us working in those places. So there are opportunities even for illiterate people, for the non-educated, the uncertified individuals. The value chain, the food value chain is endless. There is job creation.
Okay, that's fine. That's fine. I think what the point that I hear, in terms of the connection even to our hotel business, because Imo State has a good hospitality sector. So sometimes you walk into some hotels or eatery places, they just have a standard food for everyone. Somebody may have kidney issues or heart issues or that, but they can't find what they want to eat in these places.
Yeah.
So what they are saying is that we need people like yourself advising these hotels, right?
Oh, yeah.
And they can begin to customize, and that way also they increase their customer base. They are also able to attract the right people into their hotels and facilities, right? So it's about that customization, and they need experts like yourselves to guide them. But that's a fair point, and maybe people here who are in the hotel business listening might want to come to you, or even look for people like yourselves to help them in their menus and stuff like that. But let me quickly go to Dr. Ajero to introduce himself, and then Dr. Nzako can come in.
We're looking at so many potentials that lies in the pharma industry. Particularly, the pharmacist is the gatekeeper, when it has to do with drugs. And we all know that there's actually nothing that will just be very possible in the treatment line, the value chain, of the health sector without drugs. You see, looking at what happened recently with the COVID-19, you come to know that if not for the intervention of some pharmaceutical companies, in bringing in vaccines, it would have been a very big problem that most persons may not be able to handle. So that issue has just been there, and so many persons are beginning to appreciate that pharmacists who are drug experts have a very big role to play in this industry.
Okay, great, that's fine. So you're a pharmacist, and sorry, what's the name of your pharmacy? Because we didn't get it earlier on. Okay, I think maybe he's having communication challenge. Dr. Nzako, you wanted to come in earlier on.
Yes, I wanted to ask Dr. Kechi this brief question. Right, okay. Right. Obviously, Dr. Kechi, it's taken you quite a while to become who you are professionally. But as this program would also appeal to younger ones who may want to be like you tomorrow, do you have any provision in place where you can take on younger ones? Maybe they may have been to university or they may not. Can you train them, perhaps lead them to where they can now have access to hospitals and local eatery places to begin to offer guided advice about nutrition to those centers? Myself, for instance, I need to be taking care of my food. I struggle to find the appropriate food to eat here. So if I have somebody, an assistant trained by you, I would rather employ that person to guide me on what I eat and what I don't eat. So do you have any structure in place to engage younger ones, equip them with experience and knowledge, and probably discuss with the Commissioner for Health and see how that can fit into the Imo State health sector, but maybe with license or no license.
Yeah, thank you very much. We have things like that. We have opportunities like that everywhere. Like I said, I have been in the practice for a long time and I've experienced so much. I've trained people, even housewives. I trained them how to take care of their husbands, especially people that have special medical needs in so many places, privately and in the hospitals. We have what we call therapeutic cooks also that we train. If they come over, we will train them and tell them what it takes to give, for example, a diabetic patient the right food to eat, or an ulcer patient, or a hypertensive patient, or an overweight patient, the right kind of food to eat. We train them, we have them in hospitals and in everywhere. Even privately, I do train them too. In hotels, we do too. If they invite us, if any hotel, any serious-minded hotel will be interested in good nutrition, especially for all those high-class patients, or rather guests that are coming. You know, most of them will come in with all forms of illnesses. You cannot just give them any food for everybody. You must ask, you know, what do you want? Why do you have any health issue? Is there any food you cannot eat? Do you have allergies and all that? And that should be taken into consideration. And we train them when they invite us.
Okay, thank you very much.
So that can be done in Imo State. That can be, I will encourage the government to do that, to invite us, to do whatever we can do to make sure that everybody.
What I'd like to see you do, Dr. Nkechi, to help our people in Imo State is put up a structure in place where you can run it as a business here, recruit some of these young people, train them properly, getting support from the commissioner that is present here today, where you can now say that you have trained 50 Imolites, and you give them basic education about what you have told us here today. And they can go out there to earn a living or get this unemployment. Some graduates maybe become your students as well. So there is opportunity I can see there, but what is lacking is the structure to take people from level 1 to certain levels where they can start earning a living. So we need to find a way to monetize what you know, what you can do. So that's my thing.
Interesting. Yeah,
okay.
We'll do that.
That's an opportunity for you, Doctor.
Dr.
Nkechi Anyanwu there, right? So
yeah,
okay.
Yeah, that's a beautiful opportunity. Yeah.
Okay,
we would
great.
love to do that.
Okay, Dr. Ajero.
Good morning, Imolites. Happy Independence Day. I was talking before I had a little network problem. You know, as the pharmacist, like I said, there's a lot one can contribute in the value chain, health sector. And because we've seen that, you know, when a problem comes up medically, the need for drugs to be available is there. So, and the pharmacies, being who they are drug experts. Like if you see what happened during the COVID-19, it was the intervention of some scientists and pharmacists that led to the production of vaccines that was able to help to curb the high mortality rate. So I would just like to talk about one or two things, opportunities, potential that lie therein in the pharma industry, pharma space. It's a large market, like everyone knows, a very large market that may be harnessed into revenue hubs for Imo State. And as a matter of fact, we may be looking at one or 2 points or areas we think that the state can benefit and the public as well. I'll be looking at the research and development of herbal and pharmaceutical products. I have good news for Imolites. His Excellency, the Executive Governor of Imo State, as a man with a great vision, saw the potentials in the area of research and development of pharmaceutical products into finished formulations. His vision is to have a made in Imo State pharmaceutical formulation, the one we will call our own. Let me use this opportunity to inform the public of His Excellency's approval of a National Institute of Pharmaceutical Research and Development, which, as I earlier said, will enhance the process of research and development in the state. We also have the approval of the Director General of the National Institute of Pharmaceutical Research and Development. As I speak to you now, this particular process of domestication is ongoing to ensure that at least people don't go out of Imo State to do research or conduct some forms of study. This is a very good one for us. And again, we're looking at the opportunity that COVID-19 provided. This opportunity has created great opportunity in the area of helping to congest the hospitals and the clinics and reduce patient waiting time. This in its details includes the involvement of pharmacists in the immunization exercise like is obtainable in the Western world.
Okay, so Dr. Jiro, sorry, I think, we can hear some of those things, right? So I think the opportunity there in terms of the research will be one also that links to Imo State University or FUTO or other tertiary institutions.
Exactly.
I'll be happy to know that those are carried along. So the researchers themselves can begin to see these opportunities. So we want to break this thing down to the point that, like you say, the ordinary person will understand. Well, let me turn to Dr. Dozie Ihiono. I know you are a medical laboratory expert. Do you want to tell us about the opportunities you see in your space and the role you play within the health ecosystem?
Yeah, thank you so much. We have a whole lot of opportunities in the medical laboratory sector. Mind you, 80 or 85% of investigations sent in hospitals are completed in the laboratory. So huge works are done in the medical laboratory. All testings are done in the laboratory. So looking at Imo State, the challenges, because we have a whole lot of samples coming into the laboratory for processing, a whole lot of people who are coming, a whole lot of doctors who are sending samples to the laboratory for tests to be done. Looking at the turnaround time, which most times, apart from the, cushioning effect seen in the private sectors, most time the turnaround time is nothing to write home about. And that's the reason why when you go to government establishments, you can actually run a test there, and it's taking it 1 week or 2 weeks for investigations to test results to come out. So these are challenges. And looking at these challenges, you now see that you have a whole lot of opportunities in the health sector for people who are medical laboratory scientists to key into this program in Imo State, come in and then identify themselves. Government can actually do the one they can do. But in the private sector, you must not be a medical laboratory scientist before you own a laboratory. But you can invest. You can actually invest in existing medical laboratories in the state to see that they are equipped. And then you can have a whole lot of medical laboratories in the state. You can talk to existing ones so that they can actually up their game. You invest and then see that things are being done the way they are done outside the country and every other place. Let me bring it down to my own center. We have a molecular laboratory in the state. And the molecular laboratory we have in the state should actually be the second laboratory, private molecular laboratory in the state, in the entire state. The reason why people run away from this is because of the how expensive it is, the regulation, and then equipping, and then after equipping, you start talking about after sales care, because you don't have engineers who can actually come here, even when you have those things, to service your equipment for you. Most of us go as far as getting engineers from outside the country to do just common servicing of this equipment. So this is not what everybody can actually go into. You look at it from afar, it looks so juicy. But by the time you come in, you see how it is. But there are a whole lot of investors outside there in the state who, knowing fully well the impact of medical laboratory and then the huge role they play in the society, and then that burden, because you just have very few in the state who can actually do a whole lot of things, who can actually meet up with the basic standards, either in the states, in the country, or internationally. People can actually invest in those sectors, in medical laboratory sectors, and then make things move. Secondly,
sorry, Dr. Let me even ask you some basic things in terms of how you equip these medical laboratory departments or units, right? So are there roles for artisans, people who may not be medical experts, but I guess you need a lot of machines or technologies or even the maintenance of the equipment you use. So can there be opportunities for people in that space?
A whole lot of opportunities. Now, looking at biomedical scientists, how many biomedical scientists do you have? How many schools offer that course, biomedical science, biomedical engineering? How many schools offer biomedical engineering? So when you come out to the outer world, you find out that there are very few biomedical scientists. Now, even the biomedical scientists we use, who are trained by maybe what do you call it? Maybe ACFA, maybe Mindray, maybe Roche, Fuji. You find out that most of those people they use are not actually biomedical scientists. Those are people who went to university and trained in one field or the other, and still had interest in instrumentation, and then got themselves attached.
Sorry, how do you bring this down to the Imo person? So you have somebody in Owereda or Kiwe who wants to come into this space. What would you advise that person to do?
The advice is this: go to Lagos. I used to have people I sent to Lagos for training. Go to Lagos, attach yourself to people who have already, because saying go to Mindray and train is going to be very difficult. But there are a whole lot of people, engineers, who have been trained by Mindray and they are on their own.
No, Dozie, what I would encourage you to do is let's find investors who can work with you to train these people in Imo State. We can't send them to Lagos, right? How do we bring those guys in Lagos to come to Imo State and train our people and train others in Nigeria as well? So maybe Dr. Judin Zako will comment on that. And yeah, Doctor, please.
Right. Dr. Dozie, I think you're fired up there and you wish everything can be on the ground immediately. I'm quite share with your excitement about this sector. There should be a lot of opportunities in the lab sector. I mean, it's an area that not everyone can just simply rise up and go in it. But I want to ask you a question. And this question can be answered by all the people in the medical profession. Do we have anywhere in Imo State where you run continued professional development courses? Do we have anything like that in Imo State at the moment? And if the answer is no, then what are we doing to ensure that our professionals in Imo State are key into the latest technologies that are around at this moment, that even yourself, you could be equipped, you could get those knowledge, whether you train here in Imo State or you train in Lagos or wherever. That's one area. Now, I also want to ask Dozie specifically this question. You've talked about investors. Now, obviously, investors want to go to an area or they want to invest in a sector where they are sure they're going to get a return for their money. It is quite easy to bring you an investor here today. And I agree with you, there's a lot of opportunities in this sector. Have you done your studies? Have you prepared documentation to show what you actually require in this sector and prove that an investor coming to give you, say, $100 million today will be able to get his money back in a specified period of time? Have you done that research? Because it's not going to be possible for an investor to come in and start going around to understand what he needs to make the profit. You have to tell him where that profit lies within the ecosystem here in Imo State. Because if you do that, then the government, my office, and some others here today will be able to attract you the investors that you need. Because what you're talking about, what you have talked about here is equipment. You've also talked about the biomedical engineering personnel. This again, you can partner with people to bring about those results that you expect. So I'd like to stop here, but if this is an area that is of interest to you, please, you can get in touch with the Chief Economic Advisor, the Honorable Commissioner, or myself. I can assure you that we will do our best to get you the investors you need in this sector.
Okay, Dr. Judozak, I think what you have done there, I mean, let's not put Dozier on the spot. I think what you have done is just identify an opportunity for maybe researchers or consultants who do market research to say, come into Imo State, study this. And if you are into investor relations, even the banks and other financial institutions might be the ones doing this study and presenting to possible investors as ways to enhance their business development efforts. But just to mention to our listeners, those joining us, that this is the Imo Economy Study Series webinar. And we have, with the discussion today is on the business of health. And we have an interesting set of panelists, Dr. Uchenna Ewelike, Mrs. Nkechi Anyanwu, Dr. Ajero, a pharmacist, and Dr. Judin Zako, who is co-moderating it with me. My name is Kenneth Amechi. I'm the Chief Economic Advisor to the Imo State government. And our host today is Dr. Success Prosper, the Honorable Commissioner for Health. Well, let me quickly move to Dr. Uchenna Ewelike, who is an insurance expert here. We can't talk about the business of health without talking about the ability to pay. And the ability to pay in most cases is a function of people's income, and health, although health is wealth, but health is also expensive. So what role do you see health insurance playing, and what opportunities do you see in Imo State for health insurance? Dr. Ewelike, are you still with us? Yeah, maybe you want to sort your connection. Dr. Ajiri wanted to come in and saw your hand up.
Yeah, that's very true, sir. You see, for me, there are very wonderful areas we can exploit, great opportunities. Looking at areas that can bring in investors into the state. The first one is on the coordinated wholesale center, a particular space designated to, accommodate the patent and proprietary medicine vendors. We have all known that in our society today, in our country, in our state today, there is this epileptic distribution channel in which you have the fake and adulterated drugs coming into our system. Now, this coordinated process center has been designed by federal government to have these people who are not pharmacists in a particular enclave where their practices and activities will be checked. Now, we need investors who would see that as a very big area or hub for revenue generation for the state, like even the banks, because I think they're having some kind of problem in the erection of that those buildings, the structures. So it's a place that has been set aside to ensure that if this is properly harnessed, the state will reap credible mileage in the area of having all drugs coming into the system, being well checked to curb the menace of fake and adulterated drugs in our system. Yeah.
Okay, great. Thanks for that. So let's bring in Dr. Success Prosper, the Honorable Commissioner. Maybe he has some thoughts based on his reflections so far.
Thank you very much. I want to start by saying that Dr. Jordan Zako asked about a continuous medical education for all the medical related or health related workers. I want everyone to know that it is for us to have our licenses renewed. You need to meet a certain level of points or units with the continuous medical education, and every sector of the everybody or every unit of the health sector must abide by this, and they have been doing that. So there is a continuous medical education. You know, the medical field, the medical knowledge is always evolving, and we need to know what the latest is. So this is going on. Now, when it comes to biomedical training, the Federal University of Technology, Owerri, train biomedical engineers. The state is partnering with them, especially with the oxygen repairs. They are actually training the biomedical engineers and biomedical technicians of the state towards the oxygen plant repairs and everything. So there are opportunities lying fallow in this state in the health sector that we have not been taken up. Now let me take us back to the COVID pandemic. There was a period oxygen was off in the States. Most people didn't have oxygen. But a particular investor realized the fact that medical oxygen was very well needed. And he planted one in there. And they made a whole lot of money from there. It was an opportunity seen in the face of pandemics. So we all need to look at all this. When you look at the laboratory perspective, you have microscopes, you have ultrasound machines, you have centrifuge. We have a whole lot of medical laboratory hub in the state, but where do they get their equipment? Most go to Lagos, some get from Onitsha. And a very good investor will look at that and say, oh no, these people should not waste money going outside Imo State. There lies an opportunity for those in the market of the medical equipment. We have lots and lots and lots of opportunities. There is actually a plant, and a pharmaceutical plant in somewhere in Umuna, towards Okigwe, owned by Bioresources Development Group. They are into production of drugs. What do? They do researches using the herbal, the plants around us. And with those plants, they formulate drugs. There is an opportunity in the pharmaceutical industry there. So I want us to look in a broader way how our people will benefit from this. What are those opportunities? Our investors, there are a lot of people who have the money, but they don't know where they can best put their money into. And what is the return on investment? We know that every good investment cannot yield you the return on investment as quickly as possible. It might, but if we have a good feasibility study about the return on investment, a good investor will put his money, and Imo State is a hub for them to make their money in the health sector. Thank you very much.
Okay, great. I think what you have done, Honorable Commissioner, here is to link pharmaceutical to agriculture. And
yes,
people also say there are, even if you look at the pharmaceutical value chain, even cassava has something to do in terms of some capsules or whatever it is. So that joined up thinking might be one that we need to look into, and also as a way to showcase what is available in the state. But it's also good to mention at this juncture that our industrial policy has prioritized agriculture. So it might also be a good way to see how that links and fits into the pharmaceutical. But let me go back to Dr. Wedike. We had a bit of challenge with him earlier on to talk about the insurance part of things. Because that's very critical. How does insurance help the business of health in Imo State and further afield?
Thank you very much for that question. For every investor, one of the things that investor wants is sustainability. And what insurance does is the sustainable financing for health. Imo is lucky in the sense that Imo is one of the states that has a functional state health insurance agency. And also Imo has a full-fledged, well-backed up state national health insurance authority also in the state. So I would encourage every investor who has interest in the health sector to come to Imo because the population is there. You have a population of over 4.8 million. So service delivery will be optimal and people will be interested in accessing healthcare. But the beauty is, people will ask, how do I get return on investment if I invest? If you increase the quality of services you render and you get accredited for either as by the National Health Insurance Authority or the State Health Insurance Agency, you have the opportunity of getting regular reimbursement. Let me give you an instance. There's a facility in Imo State today, there in Owerri, that we pay, a private facility, we pay as much as 12 million every month. So what this means is you can't get from people. So sustainable financing is better and more profitable with insurance. And Imo has that latitude now because they have a functional state health insurance agency and a full functional national health insurance agency at the state. So what people need to do is to key in both providers and all stakeholders. They will be able to have sustainability on the financing.
Okay, thank you. So what you're saying in essence is that if you have, say for example, a medical laboratory and it's recognized by the state and the insurance entity there, you'll be able to pay anyone who uses you'll be able to fund such services. And if you have a hospital, it's also good to key into this scheme. So what do people need to do? How do they find you? Where is your address? How do they follow the process to be sure that they are recognized by you and the Imo State Insurance Scheme? Maybe you want to turn off your video because it appears to be affecting the quality of your contribution.
Okay, for the State Health Insurance Agency is located at near Ochiedike Diagnostic Center in New Owerri. They are sharing the same structure building with Hospital Management Board. It's just there at New Owerri. But for the National Health Insurance Authority, it's done by Shell Camp. Every provider in Imo should visit any of these to get accredited either by the State Health Insurance Agency or the National Health Insurance Authority. It will enable you to have benefit on issue of sustainability because it is not good that you have invested and you are not sure on the return of investment. So if you get accredited, you have high chances of getting all your reimbursements on services you deliver on insured patients.
Okay, what about individuals? What about citizens? So if I'm in Imo State and I want to get this either for myself or my family, can people come together, say local communities or villages and buy these insurance schemes?
Yes, obviously, it's currently even going on. During this August meeting, many people from different communities came to our office to get their cohorts, the subgroups enrolled. Communities can come as a group and get their people enrolled. Philanthropists also get their people enrolled. Now is an era of politics. Rather than people going to collect bag of rice and all that, they can ask the political actors to get them enrolled either in the State Health Insurance Agency or the National Health Insurance Agency.
How much does it cost? How much does it cost to insure one person?
It costs 15,000 naira per person per year.
15,000 naira, yeah?
Yes, and you have access to all the services that somebody who is working in Central Bank of Nigeria has.
Okay, that's good. That's good. So let's bring in Dr. Jude Nzako.
Yes, thanks, Prof. I would also want to thank briefly Dr. Foster that enumerated the opportunities that exist in our healthcare system in Imo State. Thanks, Dr. Foster. There is an area I like, it seems that we have forgotten, and this is about the home care health services. It would be of interest to touch that in because I kind of suspect that there are a lot of opportunities there for ordinary people. For instance, you have people who are discharged from hospitals who got nobody at home to assist them, people who suffer from chronic illness, people with conditions that they cannot even get out from bed. We have senior citizens, and these people, you find them in rural areas. Is there nothing that the health sector can put together for investors? Even somebody like me can open a small care agency to take care of these people. Is there anything like that at the moment? And if not, can that be an opportunity?
Let's bring in the Honorable Commissioner to talk about that, and if he's already doing something in that regard, and maybe if there is any other thing he wants to talk about.
All right. Thank you, Dr. Jude. Healthcare, home-based healthcare was actually practiced during the COVID, where we had to de-emphasize on isolation, isolating people and letting them be in their homes, and then caring for them in their homes. It is not very well practiced in Imo State, and is an opportunity where people should tap into. The truth of the matter is, some people will tap into it and go overboard. So we need to actually look at regulating certain things that they do during home care services. That is basically that. But is it an opportunity? It's a very wonderful opportunity where you have home care based nurses go to see these patients and get the patients to see the right doctor, know the right doctor to meet at the right time. I have a VIP in the States that we have arranged for home care nursing. And at every point in time he is meant to see his doctor, he sees his doctor. It affords opportunity for the home care nurse to make some money. And also when he goes to see the doctor, the hospital makes money. That is basically that for home care. And we will actually look at improving on that and actually setting a regulatory standard.
Honorable Commissioner, just to interrupt you a bit. Do you know any business, without mentioning them, do such businesses exist in Imo State at the moment?
I said it does, but not a full-blown business.
Okay.
I know 1-2 hospitals that do that. And
they don't need to be hospitals, but they can also be, social care can be, people coming together as a social
you understand,
service.
Right now, most people will think it's a hospital-based thing. That's why I said it's an opportunity that is lying fallow in the state that people need to get into and tap into it.
Okay, great.
Yes.
That's fine. I mean, let me quickly move to Mrs. Nkechi Anyanwu. In terms of the food you mentioned, somebody was asking on our Facebook chat whether there are some crops we recommend, for us to grow. I know people have different views about certain things. Say, for example, bitter cola. What does bitter cola do? So are there some local crops you encourage people to invest in because they are healthy in themselves and can also help our diet?
Yeah, thank you. When we talk about food is all encompassing. All foods are all important. Anyone they can invest in, anyone they can grow is as important as the other one. Bitter cola, like you mentioned, of course, we all know from long time ago, it's very helpful, it's very medicinal. Even the pharmacists will tell you that it helps in clearing of the throat when you have cough or catarrh and all that. Not just that, every other food, every other farm produce is as well important. They can get into plantain farming They can get into, from that we can make all these diabetic diets, low calorie foods, high fiber diets and all that. If we can have high quantity of plantain produced in Imo State, even if it's just that alone we are doing, that alone we can export out of the country, we can use within the state, export to other places, because I know it is on high demand. A lot of people are diabetic, a lot of people are hypertensive, and they need, just that alone would help and go a long way. They can go into potato farming. You can go into so many other things that they can do. Anything you find your hands upon to do will really be of great help in Imo State.
Okay, what should people avoid? What should people be careful in consuming? You know, because some people have argued that the nature of work has changed. Before, we used to consume a lot of carbohydrate because we needed to use the energy for farming, you know. But now we are doing more of office related work, sedentary work. What would you caution people to be careful about in terms of knowing our culture and our food styles?
Yeah, we have, our lifestyle have changed over the years, like you mentioned earlier. It is important that, in fact, most people are all, and in fact, some people work from home, not really doing much physically. So we don't encourage a lot of high carbohydrate consumptions, particularly refined foods, soft drinks, alcoholic drinks. All those are very refined foods that we don't really want individuals, especially from an adult age, to engage in too much. Cut down on your refined foods, carbonated drinks, cut down on carbohydrates, a lot of carbohydrate foods, even the protein foods. Bring it down to normal level. We advise balanced diets, little of everything, with a lot of vegetables inside of your meal. Very, very important. Reduce fat as much as possible. All visible fat in food, visible as from the trimmings of the meat or fish or chicken or your turkey, from frying of your foods. You can use low cholesterol oils to fry, from the oil that you add into your food that you eat. All of that must be cut down. Very, very, very important, because of the effect on your heart and your whole system in general. So
Okay.
generally, you have to cut down, eat healthy, exercise properly, and you'll be fine.
Okay, fine. That's a good way to.
that is preventive nutrition. When you now
Exactly.
talk about curative nutrition, which is the clinical nutrition, which is dietetics, we now narrow it down to the ailments that the individual has, and then we now tell you what exactly you will take.
Fantastic. Thank you very much, Mrs. Nkechi. And so let's give the Honorable Commissioner for Health, Dr. Success Proper, the last word, because we've got only 80 seconds. Do you want to try that?
All right. Thank you very much. There are lots of opportunities in the nutrition area. The myocardial infarction, we have a particular bell pepper called shombo. Shombo is really very good for the heart. We encourage our people to go into planting of that kind of bell pepper, so that we have a whole lot of it. The pharmaceutical area can also compound them into capsules that can be used also. Now, for the healthcare financing, we cannot achieve universal health coverage if there's no affordable, accessible, and equitable healthcare to the citizens. And the only way we can do that is via health insurance. 12 to 15,000 naira per annum will not ordinarily, when you pay out of the pocket, take care of treating malaria. But when we pull them together, when we pull these resources together, one, we have a healthy nation and we'll have more productive people. Two, we have the healthcare centers and the hospitals, the healthcare workers having their work done at the right time, and they have their money in their pockets. Then we ask investors to look at every other place, physiotherapy, the gym, These are all investment opportunities lying in the state. We have a lot of obesity, and we need a lot of people going to get healthy via fitness. So I will encourage Imolites, I will encourage investors, I will encourage the whole of the world to come into Imo State. We have untapped resources in the health sector. Thank you.
Thank you very much. I think you have a lot of work now for Dr. Jude Nzako. So you need to go back to the value chain of the pharmaceutical companies and see how they tap into some of the resources in Imo State. And time, as usual, is not our friend. We are up to the hour, and we want the radio stations to remain healthy. So we will end here, and this is an opportunity to thank Dr. Success Prosper, the Honorable Commissioner for Health, Dr. Uchenna Ewelike, the insurance expert, Mrs. Nkechi Anyanwu, the dietitian, Dr. Ajero, the pharmacist, and Dr. Jude Nzako, my co-moderator, who is the DG Imo State Investment Promotion Agency. So it's at this point I wish to wish you again a happy 62nd Independence Anniversary, and to thank you on behalf of my office, Jovita Agu and Adeza Shaheme, for this outing. I wish you a very happy celebration and weekend. My name is Kenneth Amechi, the Chief Economic Advisor to the Imo State Government. Bye-bye, and see you next time.